Hi everyone. I am going to present dissociative identity disorder as my psychobiological disorder today. I've chosen this specific disorder as it is very rare. You only see it in 0.01 to 1% of the population, and mostly in women. I also believe that sometimes it is overlooked and maybe misdiagnosed, but I do find it extremely interesting. So let's first have a look at what is dissociative identity disorder. Dissociative identity disorder is diagnosed when a person is having two or more personalities, and each personality has the capability of controlling the patient's behavior, relationships, and even memories. The primary or the main person can be fully aware of these additional personalities or fragments within their mental or mind state. And any stressful event can trigger a specific personality to come forward and take control of that specific situation. So why does DID occur? Because of a repetitive, overwhelming childhood trauma. That is the main cause of dissociative identity disorder. It can be any traumatic event occurring in a child's life. And when we look at the purpose of the condition, it is quite extraordinary. It's the brain's coping mechanism that forms different personalities or fragments of personalities to protect the person from feeling those harmful feelings or experiencing the specific trauma. So then the altered personality goes through that situation so that the primary person doesn't feel. Looking at the brain of a person with dissociative identity disorder, we will mainly look at the limbic system. And this is where traumatic memories are processed. So the limbic system of a DID patient will be much smaller than that of a person who does not have it, because that specific childhood trauma negatively interferes with the development of the limbic system. And then research also found that clients with DID have increased activation of their brain's orbital frontal cortex, which inhibits activation of the amygdala and insular cortex, as well as hippocampal areas, where your traumatic memories are stored. So therefore, a decreased activation means a decrease in volume and resulting in memory cell damage. So my patient that I've created for this case study is a 22-year-old female, Alicia Weeb. She's a white Canadian from Swift Current, Saskatchewan. She lives in an apartment building on her own. She was diagnosed with dissociative identity disorder quite a few years ago, as well as some anxiety and depression. The history of her psychobiological disorder is chronic, and she very seldom gets sudden relapses. Comorbidities are anxiety and very seldom mild substance abuse, which is mostly alcohol. Her existing social support system, she has a boyfriend who is aware of her mental illness and supportive. She's also got a supportive grandmother and belongs to a church women's group. So just to give you a little history on Alicia, she is a known dissociative identity disorder patient. So she's fully aware of her mental illness as well as the altered personality or personalities. And extreme stresses in her life may cause a relapse, which then requires hospitalization, as in this case. And then these relapses then allow an altered personality to take control, and this is what caused the anxiety for Alicia. and the feelings of loss and control, because she struggles to regain control of the primary personality. So moving to the nursing process, therapeutic communication skills would be needed in this case. So firstly, I would use phrases like, tell me more about the things or feelings that make you anxious. So in this statement, I am asking a question to elicit a patient response. So I want Alicia to speak, to tell me more about her anxiety levels, what caused the anxiety, by asking an open-ended question and allowing her to speak. Secondly, I would say, you seem upset with the voices today. What are they saying? So here I observe and recognize her emotions. I see that she is upset or anxious today, and I encourage description of perception. So she knows that it is the altered personalities coming forward, and we are aware of her diagnoses. So we need her to describe what she's feeling, what the voices are saying, and what the other personalities are actually saying to her. So the two main nursing diagnoses I'll discuss today is firstly anxiety and powerlessness. And this is related to a feeling of loss of control of her own emotions, behaviors, and awareness. Secondly, ineffective coping and role performance, which is related to alterations in identity and feelings of loss and control. So what are my goals for treating Alicia? For anxiety and powerlessness, Alicia will recognize the onset of feelings of anxiety and use relaxation techniques as well as her medication efficiently to reduce the acute anxiety and loss of control. She will therefore report a decrease in stress levels and feel more empowered. For ineffective coping and role performance, Alicia needs to stay focused, seek help from family, peers, friends, and healthcare providers when situations are starting to feel overwhelming and when she realizes or feels that altered personalities are trying to take control. So what am I as the nurse going to do? How am I going to interact with Alicia? For anxiety and powerlessness, I will maintain open-ended questioning and speak to the personality that is forward. Once we regain the calmness by maintaining a calm milieu, the primary personality will come forward again. But getting to that, we need to provide an environment that is quiet, supportive, and surround the patient with simplicity so that she can collect herself and regain control. For ineffective coping and role performance, we are going to focus on the short-term goals and small successes instead of the feelings or the situations that made things worse. We will also, once Alicia gained control and focus and the main primary personality is forward, we will assist her in seeing the consequences of using the dissociation to cope with stress. So for my evaluation, for anxiety and powerlessness, ultimately the anxiety levels has been reduced and the patient recognizes the triggers that caused it in the first place. She regains control and feels empowered. For ineffective coping and role performance, new coping strategies allows Alicia to cope more effectively, and control is gained by the primary personality. So my treatment outcome for Alicia, for anxiety and powerlessness, Alicia recognized acute anxiety triggers. She used her relaxation techniques efficiently, and that promotes control of the altered personalities and reduce anxiety levels faster before the altered personalities can take full control. For ineffective coping and role performance, Alicia's primary personality is focused and able to control difficult situations, as well as keep the altered personalities intact. She's not afraid to ask for help when needed. Because our main goal and outcome would be for Alicia to have her primary personality control the entire system. And by system, I mean all the personalities involved. Moving to the psychotropic medication. In the case of a dissociative identity disorder, a patient would be on multiple psychotropic drugs, not just one, in order to gain control and to help her with this medical condition. But if we only have to look at one, for this situation that we are currently in, we are going to look at lorazepam. And lorazepam is fast acting. It'll work within minutes, which is the effect that we want in this case. So what is lorazepam? Lorazepam belongs to a drug group called benzodiazepines. It is used in the treatment of anxiety, and it works by calming your brain and nerves. So that is also how we can explain it to our patient. What are things to avoid? Alicia needs to avoid alcohol, and by looking at her case study, she seldom or sometimes uses alcohol. So we really need to focus on that health education. While using the lorazepam, which will be short term, she needs to avoid the use of alcohol because it can cause serious side effects. She also needs to avoid not stopping this drug quickly, but once she has her anxiety under control, with the help of a healthcare worker, the drug can be titrated down. How and when? Because lorazepam has a calming sedative effect, it might be better to use in the evenings and not during work times, but it can be used up to 3 times a day if really needed. So with Alicia, it can be discussed what is the best time to use the medication, and then she should stick to that specific time. Things to look out for: she needs to look out for any signs of respiratory distress, drowsiness, tiredness, or maybe suicidal thoughts. Community support services that we are looking at our Swift Current Mental Health, which can give her continuous support, and there I provided her with the address and telephone number. We also looked at the center because she belongs to a women's church group. We decided to involve a spiritual support, emotional support, which is the center for Alicia. And then if she needs to talk a little more in depth, we can go to a psychology service, which is Brunswick Creek Psychology Service. And these services she can all reach within her community. Looking at crisis intervention. If things get really bad, the Cyprus Regional Hospital, the ER department, is open 24/7. And she can reach them by the telephone number that we provided or phoning 911. And then also the Southwest Emergency Youth Center deals with mental health cases and acute attacks, where she can reach them in the case of an emergency. So that is my patient Alicia. I hope you enjoyed the case study and learned something new about dissociative identity disorder. Thank you.